What do you do if you want to start couples therapy with your partner, but they don't seem to be interested, or they're flat out in opposition? Well, there can be myriad reasons why someone might be reluctant to start couples therapy, and it can help to approach your partner's resistance with curiosity rather than defensiveness or insistence. As a couples therapist, I've watched couples move from a place of resisting couples therapy to ambivalence about couples therapy, and eventually to a place of open-mindedness with enough pacing and patience on each partner's perspective. So in today's video, we'll discuss some of the common reasons someone might be reluctant to start couples therapy and how to address this type of conversation constructively. If you're new here, my name's Dr. Kate Balestrieri. I'm a licensed clinical and forensic psychologist, certified sex therapist, certified sex addiction therapist, and packed couples therapist, and the founder of Modern Intimacy, a therapy practice nationwide with providers across the country. If you're interested in topics about sex, relationships, and mental health, subscribe to this channel and comment below with any questions you might have for this video or future videos. And don't forget to subscribe to our newsletter by going to modernintimacy.com/newsletter. There are several different reasons why people might feel resistant to start couples therapy. First and foremost, it's worth addressing the fact that there tends to be some stigma around therapy in general, and there can be added layers of stigma when it comes to couples therapy. For a lot of folks, there's this idea that couples therapy is only necessary if a couple is bordering on a breakup. So some people feel like attending couples therapy means that there's something inherently wrong or broken about the relationship. So they avoid therapy because they want to avoid the possibility that that could be true. But I'm here to tell you, as a therapist who frequently works with couples, that the couples who see positive outcomes in couples therapy tend to be the couples who come to therapy soon after a problem arises, instead of waiting for things to reach a breaking point. In fact, studies have shown that 70 to 80% of couples report more relationship satisfaction than those who have never attended couples therapy sessions. Specifically, research shows that couples therapy for most couples results in improved relationship satisfaction and better mental health outcomes. So let's discuss some of the additional reasons why someone might be resisting couples therapy. The fear of the unknown. Another common reason that someone might be resistant to couples therapy could be anxiety around not knowing what to expect, specifically if it's their first time attending therapy. This can be especially true for folks who are not very comfortable expressing themselves or discussing their emotions, or who don't like to be perceived, especially with people they don't know well, like a new therapist. Some people have a belief that the therapist will choose sides. It's a common misconception about couples therapy that a couples therapist will choose side or somehow determine who is right and who is wrong in the partnership. Defining who's right and wrong is actually not the function that a couples therapist serves. Instead, couples therapists can help to shift your perspective in the relationship so you can operate from a place of empathy together and holding space for each other's experiences and feelings instead of trying to win an argument. Couples therapists help you stay connected and on the same team by providing tools, insights, and strategies that help you put in place a blueprint for how to communicate effectively in replace of your old patterns, the ones who got you here in the first place. The cost of therapy is another big barrier. Whether individual or couples therapy, some people have a really hard time making sense of the financial investment of therapy services, especially knowing that therapy is a process and most people need more than just a few sessions to make changes and reach their goals. In addition to financial hardships, some folks really devalue therapy because they devalue the practice of being emotional or being relational, and they don't think that it should be something that requires extra help. In fact, couples who've been interviewed about barriers to couples therapy identify the cost as one of the most significant barriers. The financial investment that goes into therapy is way more than just the money. It's also an investment in the health and well-being of your relationship. So when you're looking into couples therapists, if finances are a concern for you, you might want to ask the therapist that you're interviewing if they have any space or opportunities for sliding scale rates. Sliding scale rates can often be helpful in making therapy services more sustainable over time, so you don't have to end therapy before you're ready. One partner might see therapy as a punishment because they feel like they're being blamed for what's going wrong in the relationship. If they think therapy is punishment or a way to further more blame on their plate, that can inform the way they show up in sessions if they're willing to show up. and how much effort they put into the process. So while the initiation of couples therapy typically does stem from discord in relationship, the focus that one partner has on couples therapy being a form of punishment might speak to that partner's own inner conflicts and could be something to explore in couples therapy. Additionally, it's worth mentioning that couples therapy isn't about identifying issues within the relationship exclusively. It's also about identifying and bolstering the strengths and positive aspects of what makes you great partners. Some folks have had negative experiences with therapy in the past. Sometimes people develop certain assumptions about therapy due to previous negative experiences. It's understandable. A bad therapy experience can shape how you feel about starting therapy again. And it can be a great opportunity to have a corrective experience in contrast to the previous negative experience that you had. Here's where interviewing a few different therapists can be really helpful, because you can explain to them what didn't work in your past therapy sessions and what you'd like to get out of your therapy sessions now, especially in your couples work. Providing feedback to your therapist is a super helpful way to make sure that your therapist is on the same page with you and can make adjustments to their therapeutic approach when necessary. It can be challenging to hold space for your partner's avoidance if you're really motivated to get started in couples therapy, especially if you keep having frequent relationship conflicts and you feel like you've been in a rut for some time. If you feel able to, making the topic of couples therapy a slow, ongoing conversation can help resistant and ambivalent partners feel more at ease with the idea instead of ambushed. However, depending on what the issues are in your relationship, you may not have the patience or the time to move at a slower pace, particularly when there's the presence of addiction, abuse, or infidelity in a relationship. If you're able to move at a slower pace, there are a few things you can do to help your partner get a little bit more comfortable with the idea of starting couples therapy. The first is to get curious with your partner about their avoidance, giving them space to be open and honest with you about their feelings and fears regarding the process. You might want to ask them if they even know what their resistance is, where it's coming from, and what fears might be coming up when they think about beginning. When your partner expresses their concerns about couples therapy, you can also practice active listening. This is really important because you've got your agenda to start couples therapy, but your partner has their agenda, and that's to protect themselves. So active listening means listening to your partner's position without judgment or defensiveness. Active listening is inherently empathic and creates an opportunity for you to validate your partner's feelings and perspectives, even if they're different than yours. Discuss what you and your partner hope to achieve through couples therapy, what expectations you each have, and how you'll know when you're making progress, reaching a plateau, or having a regression. It can also really help to communicate your individual and shared expectations with your couples therapist so they have an idea where you're starting from and what you hope to achieve together. They can keep those expectations in mind during their work with you. It's possible that the conversation of couples therapy will take more than one attempt before making any concrete steps. So to mitigate anxiety, it's really important to discuss a tentative timeline in terms of taking the next steps and any boundaries that you and your partner might have about these discussions. For example, it might be your partner's boundary to avoid the conversation about couples therapy after work or on the weekends. It might be your boundary that you don't go more than 2 weeks without revisiting the conversation. Whatever boundaries and agreements you make together are dependent on what you both need, so they'll be unique to your relationship and they're best established collaboratively and together. Couples therapy tends to work best when everybody's open and engaged in the process. But that's not to say that couples therapy can't be successful if one partner is a little bit more guarded, but it will take more patience and compassion on everyone's end. Having compassion for each other and patience for where each of you are starting in the process is crucial in getting off on the right foot. And if you've tried all of this and your partner is absolutely vehemently opposed to starting couples therapy, they don't see the value, they don't appreciate your perspective in this pain and your desire to change things, you can still start therapy without them. Sometimes doing that is enough to create a shift in the system of your relationship, because your partner may not be willing to go to therapy, but if you start showing up differently and having different boundaries and expressing yourself differently, that can be enough to evoke some change in the relationship dynamic. Now, you may decide you don't want to do all of that emotional labor by yourself, and that's fair, but your choices are limited if your partner's really opposed to the process. So you might have to make some tough decisions. So that wraps up today's topic of couples therapy when your partner is resistant. I hope you found this video to be helpful, and don't forget to subscribe to the channel if you'd like to hear more topics like this one, and feel free to leave your thoughts and opinions down below in the comment section. If you'd like more support, you can contact the Modern Intimacy team. Our website, modernintimacy.com, has tons of resources and free blogs, and there's a place on our contact page where you can schedule a free 30-minute consultation, or you can go to modernintimacy.com/contact, and we can help assist in aligning you with a therapist or a coach on our team. And finally, don't forget to download my weekly podcast, Get Naked with Dr. Kate, on your preferred podcast platform.